What role do baroreceptors play in CFS orthostatic intolerance? Have you ever wondered how your body manages blood pressure when you stand up? This is where baroreceptors come into play. Baroreceptors are specialized sensors found mainly in the carotid arteries and aortic arch. They detect changes in blood pressure and help regulate how your body responds to maintain stable blood flow, especially when you change positions. In individuals with chronic fatigue syndrome, myalgic encephalomyelitis, or CFS, the function of these baroreceptors seems to be impaired. This impairment is significant because it contributes to a condition known as orthostatic intolerance. Orthostatic intolerance is when a person has difficulty maintaining blood pressure and adequate blood flow upon standing. This can lead to symptoms like lightheadedness, fatigue, and a rapid heartbeat. Research shows that in CFS, the normal reflex that adjusts heart rate and blood vessel tone in response to blood pressure changes is often blunted. This is referred to as baroreflex dysfunction. When baroreceptors do not function properly, it can disrupt the autonomic nervous system, which controls involuntary bodily functions. This includes the balance between the sympathetic nervous system, which prepares the body for fight or flight, and the parasympathetic nervous system, which promotes rest and digest. One of the key issues is reduced heart rate variability. Heart rate variability is a measure of how well the autonomic nervous system can adapt to changes. Lower heart rate variability in CFS patients indicates diminished sensitivity of the baroreflex and impaired control of the autonomic nervous system. This can correlate with the severity of fatigue and other orthostatic symptoms. Additionally, when baroreceptors fail to properly regulate sympathetic activity, it can lead to excessive sympathetic drive. This means the body might experience an increased heart rate, constricted blood vessels, and heightened feelings of fatigue or pain. Baroreflex impairment in CFS also overlaps with conditions like postural orthostatic tachycardia syndrome, commonly seen in CFS patients. This condition is characterized by an excessive increase in heart rate upon standing, suggesting a shared mechanism involving autonomic and baroreceptor dysfunction. The impact of impaired baroreceptor function can exacerbate various symptoms, including fatigue, pain, cognitive difficulties, and sleep problems. This happens because normal autonomic regulation and cardiovascular stability are disrupted during daily activities and stressors. Understanding the role of baroreceptors helps explain why individuals with CFS often struggle with standing and experience post-exertional malaise triggered by even mild orthostatic stress. It also emphasizes the importance of managing orthostatic intolerance symptoms through non-pharmacological strategies. These may include wearing compression garments, staying well hydrated, and pacing activities. While baroreceptor dysfunction is not currently reversible through specific treatments, it can be managed symptomatically. Overall, baroreceptors are crucial for maintaining cardiovascular stability during posture changes, and their dysfunction in CFS plays a significant role in contributing to orthostatic intolerance symptoms.